Canada's Auditor General says the country was not ready for the COVID pandemic. Karen Hogan issued 2 reports today, one on the medical equipment stockpile and one on how the government responded to the needs of Indigenous communities during the pandemic. And when it came to the emergency stockpile, Hogan says the Public Health Agency of Canada was not as prepared as it could have been to respond to the surge in provincial and territorial needs for personal protective equipment and medical devices brought on by the pandemic. Despite expanding access to contract nurses and paramedics, over half of requests for additional healthcare staff to respond to COVID-19 needs were not met. The government says it accepts all of the Auditor General's recommendations on what needs to be improved.
We accept this recommendation and thank the Auditor General once again for this report. Her advice, her recommendations will guide our ongoing response to the pandemic and help to prepare Canada to respond to future emergency situations.
Karen Hogan is Canada's Auditor General, and she's with us from Ottawa. Auditor General, thanks very much for joining the program. And I really want to start with PHAC and the PPE. What was the biggest thing that contributed to not being prepared as the pandemic slammed us?
Really was the National Emergency Strategic Stockpile that was not ready to support a response to a pandemic. The Public Health Agency had not addressed longstanding and known issues that the agency itself had identified in 2010 in an internal audit in order to address some of the weaknesses in how they managed and operated the emergency stockpile. And that was really the main finding as to why the agency was not as prepared as it could have been to respond to the needs of requests from provinces and territories.
And so back then, at the beginning of the pandemic, we saw this sort of frantic effort to try to make up for that deficit, to buy PPE from anywhere. But one thing that I note in your report is that you're recommending on procurement now that Procurement Canada should really look at the financial strength of the companies it's buying from. Was there a particular concern about the capacity of companies to deliver? What brought you to that recommendation?
So you're absolutely right. At the beginning of the pandemic, the stockpile just didn't have equipment to respond to the needs, and there was this pivot and move to address all of the increase in requests. And one of those things was moving to bulk procurement that was led by Public Service and Procurement Canada on behalf of the Public Health Agency. Public Service and Procurement Canada took on some additional risks. One was invoking the national security exemption, which allows for procurement to happen without a competitive process. And the second was accepting the risks associated with making prepayments. And when those prepayments happen, there should be a financial assessment of the viability of the organization that you're supplying your goods from. What we saw was that in 50% of the contracts we reviewed, that assessment had not been done. And so while you're trying to balance the risks with the need for speed, I do believe that the department should have at least done that step. So we did find one contract where goods had not yet been received, yet a prepayment had occurred, but the department has already started litigation against that organization.
So of all the instances, there was just one that you found where they paid money, didn't get the PPE in return?
Well, we looked at a sample of contracts. So we looked at 39 out of 85 contracts that covered the personal protective equipment that we were looking at, which was gowns, masks, gloves, testing swabs, and ventilators. And in that instance, there was one out of the 14 that had prepayments that the goods had not yet been received.
Do you think the various government agencies have actually learned their lesson on this?
Well, I hope that they appreciate that being in reactive mode is difficult, and that the government turns its attention to really investing in things that people just don't see, whether that be an IT system that supports an important program, or in this case, the stockpile, whether that be addressing long-standing issues like what to put in the stockpile or how to have adequate nurses in Indigenous communities. We shouldn't see the government always in a reactive mode, but they should be thinking long-term and recognize the importance of being better prepared for the next emergency.
I just want to shift gears on your second report, and this looked at Indigenous services during this pandemic. And you found that the difficulty in getting PPE to Indigenous communities, including remote areas, in a timely manner, it did certainly have challenges, but what were the overall findings there in terms of getting PPE to those communities?
So I think when I look at the report on Indigenous Services Canada, I would tell you it's a good news, partially bad news story. And the good news was that they were able to deliver personal protective equipment to many Indigenous communities in a rather quick way. On average, it was about 10 days to respond to a request for personal protective equipment, which when you think about how remote and isolated at least 51 of those communities are, that's really good. They were also able to increase the number of nurses and paramedics in those communities to help deal with health concerns. However, the bad news is that despite all of those efforts to increase the pipeline of healthcare workers, the department was still unable to address more than half of the additional needs that Indigenous communities had because of the pandemic.
Yeah, and this is COVID related, but of course there are ongoing challenges in these hundreds of communities right across the country in getting healthcare staff, trained healthcare staff, and I know that's something that your office certainly has looked at in years past.
Oh, absolutely. I think this was just a sign that when something goes unaddressed, so when there's already a shortage of healthcare workers and a pandemic or a health emergency occurs, it just makes it worse. And that's exactly what we saw here. Even though Indigenous Services Canada was able to, as I say, hire more quickly and sign new contracts for nurses and paramedics, they just couldn't keep up with the increase in demand.
Can your report does not look at vaccine procurement. You've looked at the PPE, but is the process of vaccine procurement something that's likely to come under your microscope in the months ahead?
Oh, absolutely. We've actually started some of the initial work on vaccine procurement. We're looking at the vaccine contracts in the context of the financial audit of the Government of Canada, where the financial statements will be published in the Public Accounts of Canada. And then later this year, we will start a performance audit on vaccines with the intent of trying to release that in the later half of 2022. I've also started a dialogue with my provincial counterparts, the Auditors General in the provinces, to see if they would like to coordinate the timing of the release of our reports, and they could pick up that provincial side of vaccination. So I'm hopeful that a few of us will be able to at least coordinate that and give Canadians a picture of vaccines from approval of a vaccine all the way to the shot in the arm across these two audit reports. So yeah. I'm looking forward to doing it.
Certainly from a financial perspective, I know there has been interest expressed at the political level and elsewhere about how much Canada paid relative to other countries for the various vaccines that have been approved and are in use, and the speed with which Canada got some of those vaccines, particularly in the earlier months. Is that something that you would end up looking at?
Well, we haven't really defined the scope, but we'll definitely be looking at speed of delivery and vaccine approvals and how that process was expedited and so on. I do know that we will look at the costs and we will audit that. However, we likely will be a little restricted in what we can report, given the confidentiality clauses that are included in these contracts, but we definitely will be able to do the audit work.
All right. Auditor General, thank you very much for your time this afternoon.
Thanks. It was great being here.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.